Ms Maxwell with a question, please.
Thank you, President. My question is to the Minister for Ambulance Services, Ms Makakos. It concerns yet another case, this one in Myrtleford in February, of exceedingly slow ambulance response times in Northern Victoria. This patient who had a strangulated hernia actually needed an ambulance twice, but neither arrived for around an hour. No set team was available either, and all these problems were exacerbated by the apparent failure of the ambulance crews and hospital staff to even communicate with one another about the patient's condition and requirements. This patient had recently had a similar medical condition. Minister, what do you and/or Ambulance Victoria currently regard as a reasonable time for a person with a strangulated hernia to have an ambulance arrive and be transported from Myrtleford to a hospital in Wangaratta?
Minister.
Thank you. I thank the member for her question. Look, I'm very sorry to hear that Ms Creswell Dawson had a bad experience with the health services in the Alpine region. Upon learning of her experience, Ambulance Victoria followed up immediately with Ms Creswell Dawson to address her concerns in mid-February and have since spoken to her again earlier this month. I'm advised that an ambulance was dispatched to Ms Creswell Dawson. However, she had already been taken to Myrtleford Hospital by private means and Ambulance Victoria was not advised. This means that paramedics were sent to an address where there was no patient. A call back from Ambulance Victoria to Ms Creswell Dawson revealed that she was already at Myrtleford Hospital, and I'm advised that the attending paramedics were then dispatched to another job. Alpine Health in Myrtleford is a multi-purpose service and it provides emergency care through urgent care centres which are staffed by highly qualified registered nurses and supported by local GPs on an on-call basis. It doesn't operate a 24-hour emergency service. Following clinical assessment by nurses at Myrtleford Hospital, an ambulance was dispatched to transport Ms Creswell Dawson to Wangaratta Hospital. And I take this opportunity to remind the community that Ambulance Victoria is a statewide service and every OOO call is assessed on clinical need. An ambulance is always prioritised to respond to the sickest patients first, especially those with life-threatening conditions such as major trauma, heart attacks and strokes, and members of the community are discouraged from presenting to an ambulance station for treatment and should always call OOO in an emergency. Our paramedics are continuously working on the road and to go from patient to patient and only respond to cases through 000. I also take this opportunity to remind the community to keep Ambulance Victoria updated if they change locations so that they're able to respond in a timely and efficient manner. So since 2015, we've put in place nearly 25% more resources in the Hume region than was the case under the previous government at the time of their time of office. And the latest quarterly performance data shows that our paramedics in Hume responded to 4,300 emergency cases in the October to December quarter, 332 more than the same period in 2018. In Alpine Shire, ambulance arriving at the scene of emergencies in an average of 19 minutes and 42 seconds, more than 3 minutes faster than since we've come into government.
Ms Maxwell, supplementary.
Thank you, President, and thank you, Minister, for that extensive answer. Minister, the 2019-20 Statement of Priorities Agreement that you signed with Ambulance Victoria includes these key goals. Care is always being there when people need it, equal access to care, and people are connected to the full range of care and support they need. Minister, on the basis of the continuing emergence of so many unacceptable incidents in non-metropolitan areas, these priorities are clearly not being realised. So could you please explain to my constituents what actions you are now going to take in order to improve ambulance resourcing and response times that continue to fail critically ill people in Northern Victoria? I ask that especially in light now of the growing pressures confronting the state's health system because of the coronavirus.
Minister.
Well, I thank the member for her further question. Those decisions by Ambulance Victoria are operational ones and they will always be based on clinical decisions about need. And of course you would expect that paramedics would attend to the most urgent cases most urgently. This patient, as I've explained in considerable detail was deemed non-urgent by Ambulance Victoria. But in terms of what we're doing more broadly, our government, since we've been in office, has invested an unprecedented $1 billion into Ambulance Victoria. That has enabled them to fund 855 new paramedics, 855 FTE of new paramedics, on-road clinical staff, 35 new and upgraded ambulance stations, 51 emergency vehicles across the state. Now, that's a significant increase, more than 480% in fact, since we've come into office. And we've seen the best ever response times as a result. 84.2% of Code 1 emergencies reached within 15 minutes. We are doing more for regional communities as well.
Sorry, Minister, time.
Thank you.